This video will give an overview of the MAMI Care Pathway Package. MAMI stands for the Management of Small and Nutritionally At-Risk Infants under 6 months and their mothers. Let's start by understanding why the MAMI Care Pathway is needed. Nearly half of all child deaths are due to undernutrition, and infants under 6 months are the most vulnerable. About 1 in 5 infants under 6 months is small and nutritionally at risk. These infants are at higher risk of sickness, death, and poor development. They may be born small and at risk, such as low birth weight and preterm infants, or may develop nutritional risk after birth. They might be wasted, stunted, or underweight. Despite the millions of infants and their mothers in this situation worldwide, many don't get the care that they need to survive and thrive. This is because there is a serious gap in care for these infants and their mothers, especially in community services and after the newborn period. Immediately after birth, infants and mothers are supported in newborn and early postnatal care services. But after discharge, there is little support available to them if they're small and nutritionally at risk. Routine IYCF counseling isn't sufficient to meet their unique needs. And if they become malnourished, the only option in most settings is inpatient treatment, but families often struggle to access this care. Many of these infants are clinically stable and could be managed in outpatient care that's more accessible for families, but it's rarely available. This means that small and at-risk infants are left waiting until they reach 6 months of age and meet admission criteria for wasting programs for older children. We must do better. We're missing opportunities to support at-risk infants and mothers in this critical period. This leaves fragile infants and their mothers vulnerable during one of the most challenging periods in life. Let's look at a short case study. Imagine 4-month-old Zala and her mother Ida. Zala was born with tongue tie, a common condition that can make it difficult to breastfeed. Ida struggled to breastfeed Zala and became anxious as she watched her daughter become thin and fail to grow. She attended IYCF counseling at the local health center and received advice on breastfeeding, but Zala wasn't checked for a tongue tie and breastfeeding continued to be a struggle. Ida decided to stop breastfeeding and give Zala formula because she was worried about how thin she'd become. The formula was expensive and the family struggled to afford it, but they saw no other option. Soon, Zala developed diarrhea and the family took her to the health center for treatment. The costs of getting to the health center and medication were a burden on the family. They were told that they must boil all water used to prepare formula at each feed, but struggled to do this because fuel is costly. Zala remained small and thin, so Ida decided that she needed other foods and began to feed her thin porridge. Zala failed to gain enough weight and was frequently ill. At 6 months of age, Zala was admitted for wasting treatment at the local health center. Ida continued to suffer from anxiety, but no one noticed or offered her support. Look where the missed opportunity to identify and treat a simple condition has taken Ida and Zala and their family. Experiencing malnutrition in the first 6 months of life has the potential to negatively impact Zala for the rest of her life. In the short term, she continues to be at high risk of illness and death. In the medium term, the effects of malnutrition on her development might affect her capacity to learn in school and earn a living later in life. There's also growing evidence that she might be at increased risk of non-communicable diseases in the long term. All of these effects have serious consequences, not only for Zala, but also for her children and for wider society. To bring attention to this problem and to improve care, the MAMI Global Network was born. The MAMI Global Network involves local, national, and international collaborators working together to improve policy, evidence, and practice for small and nutritionally at-risk infants under 6 months and their mothers. Our shared vision is that every small and nutritionally at-risk infant under 6 months and their mother is supported to survive and thrive. Our ultimate goal is to build strong infants, strong mothers, and strong futures to help achieve the 2030 Sustainable Development Goals. To put this vision into action and to help fill this critical gap in care for vulnerable infants under 6 months and their mothers, the MAMI Global Network has developed the MAMI Care Pathway Package, released in May 2021. Previously known as the MAMI tool, the update was informed by the latest evidence and experiences of putting previous versions into practice. The MAMI Care Pathway Package is a package of resources that was co-created by members of the MAMI Global Network, co-led by the Emergency Nutrition Network and the London School of Hygiene and Tropical Medicine. It provides guidance on how to screen, assess, and support small and nutritionally at-risk infants under 6 months and their mothers, and materials to help practitioners put this into practice. Its development was guided by the AGREE reporting checklist, which aims to improve the quality of clinical practice guidelines. The package is not intended as an off-the-shelf intervention. It requires adaptation for different contexts, depending on what the needs are, what already exists, and local resources. Let's take a look at the guiding principles of the MAMI Care Pathway Package. The MAMI Care Pathway Package always considers the infant and mother together because we know that infant well-being is inextricably linked with the well-being of the mother. One of its most important features is that it bridges interventions and links with and uses existing systems and services. We know that nutrition problems are about more than feeding alone, so the MAMI Care Pathway connects nutrition, clinical, and social interventions to provide more holistic care for at-risk infants and their mothers. It helps put the 2013 World Health Organization guidelines for the management of severe malnutrition into practice, and it's designed to embed within integrated management of childhood illness, or IMCI, an established approach to child health implemented by families, communities, and health facilities. The package is based on an integrated care pathway approach that considers the processes, resources, and participation needed to support infants and mothers from initial screening through to exit from care. Finally, the MAMI Care Pathway Package is relevant across development and humanitarian settings and different contexts. So how does the MAMI Care Pathway work to support the care of at-risk infants and their mothers? A key principle of the approach is to assess and support infants and their mothers at every community and health service contact point. There are many opportunities after birth to identify small and nutritionally at-risk infants and offer support. For example, infants who are recorded as low birth weight can be identified for community follow-up. Or infants attending for vaccinations come into contact with health services several times before 6 months of age. Infants might also present to health services with minor illnesses. It's important to take these opportunities to identify at-risk infants and mothers, to provide or refer for appropriate support, and to monitor their progress. Remember the case of Ida and Zala. If they had been assessed and received targeted support, imagine how different their story could have been. To change their story and the story of millions of infants and mothers just like them, the MAMI Care Pathway provides a simple framework to ensure that at-risk infants under 6 months and their mothers are identified, assessed, and supported across health systems and services. So what are the benefits of using the MAMI Care Pathway Package? First and foremost, it benefits small and nutritionally at-risk infants under 6 months and their mothers by improving the quality of care that they receive, helping them to survive and thrive. Improving the health and nutrition of infants under 6 months has short and long-term benefits for these infants and their families and for wider society. Carers and families benefit from an approach that aims to increase user satisfaction with health services and recognizes the importance of caring for the health and well-being of the mother as well as the infant. The MAMI Care Pathway Package also benefits frontline healthcare workers by simplifying the care of infants under 6 months and their mothers. Importantly, it aims to reduce patient workload by allowing health workers to identify and focus on the infants and mothers with the highest needs. It recognizes that supervision and referral services can be limited, and that isolated health workers need a simple how-to guide. It increases job satisfaction by offering easy-to-follow guides and solutions to deal with complex problems. This helps to ensure that serious underlying conditions are not missed, a situation that can create stress for health workers. The MAMI Care Pathway Package also offers a way to improve communication and collaboration with colleagues in other health or social services. For service managers, the MAMI Care Pathway Package provides a ready-made suite of materials and resources to help implement improved care for infants under 6 months and their mothers. It also makes it easier to audit programs and monitor performance. Policymakers and researchers can also benefit. The package translates existing policies for frontline field use, helps generate evidence that is needed for future scale-up, and bridges existing services, especially health and nutrition. Let's look more closely at where the MAMI Care Pathway fits in the wider health system. It fits in at the community, primary, secondary, and tertiary levels of healthcare. The core MAMI Care Pathway activities fall in the early postnatal and the 6 weeks to 6 months age periods. At tertiary level, if an infant is born small and at risk or admitted with a complication, they can be managed in line with a MAMI Care Pathway. At secondary and primary level, they can be identified and supported in outpatient MAMI care. And at community level, screening can be used to identify at-risk infants and mothers as part of community services like growth monitoring and IYCF, and then referred for assessment at primary level facilities. We should also look to identify at-risk infants at an earlier stage by building links with antenatal care and birth services. For example, multiple pregnancies are at higher risk, so this is an opportunity to link with MAMI services for ongoing support once these babies are born. These linkages can also be established at community level. For example, referral of small and sick newborn infants for community-based MAMI support after discharge from inpatient care is another opportunity to safeguard these at-risk infants and their mothers. Let's look at an overview of the MAMI Care Pathway. The MAMI Care Pathway has 3 key stages: screening, assessment, and support and management. Each stage is supported by user guides and forms for frontline health workers. We look at these materials in detail and discuss adaptations in part 2 of this video series on the contents of the MAMI Care Pathway, which can be found on the MAMI Global Network YouTube channel. There are many initiatives and strategies across nutrition and health with which we share a common vision and principles and support delivery of actions. For example, the MAMI Care Pathway Package supports the UN Global Action Plan on Child Wasting to accelerate progress in preventing and managing child wasting. It's consistent with the Every Woman, Every Child Global Strategy for 2016 to 2030, which advocates for collective action to support infants and mothers to survive and thrive and to transform their care. It also upholds the vision of the Every Newborn Action Plan to reduce mortality and secure the best start in early life. Through the MAMI Care Pathway, we can support continuity of care with neonatal services for infants born at highest risk. Consistent with the Small and Sick Newborns initiative, we can help small and sick newborns survive and thrive through good quality healthcare in the community with the mother-infant pair at its center. We also share the vision of the Nurturing Care for Early Childhood Development framework to help children survive and thrive to transform health and human potential. The MAMI Care Pathway Package targets nurturing care to at-risk infants for whom support for development is especially critical. One frequently asked question about the MAMI Care Pathway is how it fits with other related approaches such as IYCF and IMCI. It provides specialized IYCF counseling tailored to the individual mother-infant pair, while IYCF programs provide more general support. It refers directly to IMCI for clinical assessment, analysis, and action, and embeds the IMCI approach within the materials, providing further depth to MAMI components of care, such as feeding support, maternal mental health, nurturing care, and infant sleep. The MAMI care pathway brings together key elements from other approaches too, such as nurturing care for early childhood development and maternal mental health. The care pathway can also be used for outpatient and inpatient care. By bringing these elements together in a coherent whole, the MAMI care pathway helps unify these complementary approaches and encourages continuity and consistency of care. In summary, the MAMI care pathway package is an integrated care pathway approach to the care of small and nutritionally at-risk infants under 6 months of age and their mothers. We consider not only the infant, but also the mother and wider society. MAMI is about bridging hospital and community care. MAMI links nutrition and health and disability. MAMI considers not only weight and growth, but also function and health. And though mainly intended for low and middle income settings, MAMI is also relevant to high income countries. MAMI efforts are at an exciting stage on our path to scale up, and we all need to join forces in our collective effort. You can download the MAMI Care Pathway package at ennonline.net/MAMI Care Pathway. It's critical that we build evidence from implementation of what works and how in different contexts. We'll use your learning to shape future versions of the MAMI Care Pathway package, so please share your experiences and questions with the MAMI Global Network. You can join the MAMI Global Network by contacting the MAMI Global Network coordinator at mami@ennonline.net. You can post any questions on the dedicated MAMI area of ENN's online technical forum and net. And for more information on the MAMI Global Network and how we work across evidence, policy, and practice, visit our website. We would like to acknowledge our funders, the Eleanor Crook Foundation, Irish Aid, and the Waterloo Foundation for their generous support. And many thanks to the members of the MAMI Global Network who are responsible for an immense collective action to develop the MAMI Care Pathway package.